What's up, guys? It's James here. We're going to do a little bit of an impromptu episode here just for a little bit of a recap of the year 2021 as we head into 2022. So there isn't really any sort of script for this video. I'm just going to be talking about what I think were the most important things that happened in the year. And by the way, guys, we're going to do this as a instant release or premiere release, whatever the heck it's called. So if you have any questions about anything whatsoever, if you want to know about MindMed, if you want to know about atai, maybe you want to know if Santa Claus is real. Whatever your question is, just type it in the comment box there you see to your right, and I will go ahead and answer them in real time. I will be there for the entire release of this. Alrighty, guys, so with that being said, I hope you all had a happy Christmas, happy Hanukkah, Kwanzaa, whatever the heck you celebrate, and let's hop into it. So we're just going to run through what I think are the top 5 events or stories that happened throughout the year 2021, and then at the end of this video, we'll talk a little bit about what I'm excited for when it comes to 2022. And again, any questions, put them in the comment box throughout this video, and we will get right to answering them. So with that being said, let's hop into it. Alrighty. So I think the first big storyline of 2021 when it comes to the psychedelic medicines industry was all of the IPOs. Now, you may not remember this, but in 2020, there was only a couple companies that had already gone public. Like there was MindMed, there was Compass Pathways, maybe a couple small ones, and then that was it. That was the entire public market of the psychedelic medicines industry. Fast forward here to the end of 2021, and we got what? Like 25, 30, 40 different public companies that are all on the market right now. There are too many to even keep track of, frankly. So we're just going to go through the couple big ones. We saw that in June, atai Life Sciences IPO'd. They had a massive IPO. They're now the largest psychedelic medicines company by market cap. And then quickly after that, in July, we saw Field Trip and Cybin IPO. And those 5 kind of make up the big 5 of psychedelic stocks. You got your MindMed, your atai, your Compass Pathways, Field Trip, and Cybin. And this, like more than half of these came in 2021, so it was a big year. Of course, we don't only care about the largest psychedelic medicines companies. We also saw dozens of smaller companies IPO. So for example, we saw Small Pharma, we saw Wasana, and many, many more. We also saw the advent of ETFs. So we got the PSIL, the Advisor Shares Psychedelic Medicines ETF. We got the Horizons ETF all coming in 2021. So it was a really, really big year for IPOs. And then on top of that, we also had some uplistings. So I know this isn't technically an IPO or whatever, but in 2021, of course, we saw the MindMed uplisting to the NASDAQ. That was a big event. That was kind of the first big uplisting event. We cared a lot about it at the time. We did a lot of videos on it. It was really a turning point for the industry. But then, coming on the heels of that, we saw we saw Field Trip uplisting also to the NASDAQ. We got Cybin uplisting to the New York Stock Exchange. We got Numinus uplisting to the TSX. That just happened like last week when I'm filming this. You'll see this in a week or two from now. Whatever, getting sidetracked. Point is, huge, huge year for the advent of public companies for the psychedelic medicines industry. We went from like 3 or 4 on the public markets to like 40. And I'm sure coming in 2021, we will see even more IPOs until the point where we can't even keep track of them anymore. But that is something we'll talk about next year. Next up, the next big trend of 2021, I would say, was funding. So we've talked about on this channel so many times before how clinical trials are expensive, guys. To bring something from phase 1 all the way through phase 3 can cost upwards of $100 million. So if you don't have that type of cash, if you've only got a few $100,000, a few million, a few tens of millions of dollars, you're just not going to do much in this industry. And this industry wasn't going to do much unless it could raise hundreds of millions of dollars. And guess what? They stepped up to the challenge in 2021. And by the way, some of this might have been towards the end of 2020, but we're just gonna lop it all in together rather than try to cut it up into bits and pieces. But by the end of 2021, we saw companies like atai Life Sciences. atai has raised over $400 million. Not too shabby is Compass Pathways, who raised over $300 million. MindMed raised over $200 million, and Field Trip over $100 million. Add all that up and we get to $1 billion, and that's not even including all the smaller companies. So 2021 saw the psychedelic medicines industry raise over $1 billion to put towards different clinical trials, to put towards hiring the best scientific minds available, to put towards doing as much research as possible. Now, I know that sometimes people don't really care about how much money this company has or how much money that company has, but it's important. In order to succeed, these companies are going to need massive amounts of cash in the bank, and 2021 did that. 2021 saw these companies raise over $1 billion, and they did it the perfect time too, because a lot of these companies raised capital when their stock was at a near all-time high. MindMed did it, atai did it, Compass did it, and looking in retrospect, with all of these stocks falling in some cases quite significantly, they did it with really good timing. So I'm very, very happy about how 2021 kind of really turned a page, or was a pivot point for the psychedelic medicines industry, because for the first time it has the funding that it needs to carry out these dozens of clinical trials that we're going to see over the next couple years. And a lot of these companies are financially secure over the next couple years. So even if their stock continues to fall, which we'll get to in a bit, I'm not sure where we'll talk about that, but whatever. If their stocks continue to fall, then they're still stable. It doesn't affect them too much because they've already got the capital. And I'm sure in the future, whenever their stock prices do end up getting back up, once these clinical trials start coming back, and if these clinical trials start coming back positively, I think that we'll see much of the downward trend that we've seen over the last 8 months reverse itself. I don't know if that will happen in 2022, if that will happen in 2023, but once we start getting positive data, I would expect these companies to have their market caps rise again, and at that point they can raise more capital. But if that takes until 2024, then we're Gucci, guys. They've already got enough capital for this. Alrighty, so we got the IPOs, we got the funding and stock movements. What else was big? Oh yeah, the clinical trials. So 2021 saw a couple of absolutely massive clinical trials happen that I am super excited for, or was super excited for, and I'm still super excited to talk about. So of course, the crown jewel, the best data that we have up until this point was the MAPS phase 3 clinical trial that was using MDMA to treat PTSD. Now, this is to this date, the only phase 3 clinical trial. As a quick reminder, in order to get a new drug approved, you got to make it through phase 1, phase 2, often phase 2 and B, 2A and 2B, and then finally phase 3. So we had the very first psychedelic medicines phase 3 clinical trial using MDMA to treat PTSD, and the results were, I don't have the words for it, earth-shattering, gangbusters, paradigm shifting, whatever absolutely intense adjective you want to use, throw it in there, because 67% of people that were in this clinical trial had their symptoms of PTSD, quote, improve so much that they no longer qualified for a diagnosis of PTSD. It kind of sounds like a cure to me, guys. No longer qualify for a diagnosis of PTSD, that basically is saying that they have been cured of their PTSD. And yes, this wasn't everybody, this was only 67% of people, but that is so absolutely so much better than anything that we currently have to treat PTSD, which is basically just like antidepressants and talk therapy. So if this can be repeated in clinical trials to come, and by the way, MAPS has more clinical trials coming, we'll get to that at the end of this episode, but if we can repeat this absolutely fantastic data, then it's game over. MDMA is going to become the PTSD drug of choice. And by the way, I'm sure everybody listening to this already knows it, but when I say that, I mean MDMA paired with talk therapy. Alrighty, so they have a total of, like I said, 67% of people improved so much that they no longer qualified for a diagnosis of PTSD, but a further 21% of people also saw their symptoms decrease by 50% or greater, bringing the total to a full 88% of people saw their symptoms decrease by 50% or more. That is just absolutely fantastic. Anyhow, I'm going to move on because I could literally just fanboy about this clinical trial for hours, and we have limited time. So moving on, the next huge clinical trial of 2021 was the Compass Pathways phase 2b clinical trial. Now, this was a highly anticipated trial for a couple of reasons. First, it was the largest ever psychedelic medicines clinical trial. There were, I believe, 216 patients in this clinical trial, which, again, like I said, made it the largest ever clinical trial. It was also the furthest progressed ever psilocybin clinical trial, being in phase 2b, and the results were positive, but disappointing, I would say. But the only reason they were disappointing were because it was coming on the heels of that absolutely fantastic MAP study that we just came back from talking about, where it showed that 88% of people improved by 50% or more. So we had our expectations set so high because of this. And it just didn't live up to those expectations, unfortunately. Just to quickly give you some of the data, after 3 weeks after treatment finished, 36.7% of people that took the largest dose of psilocybin, which was 25 milligrams, did show a clinically significant response, saw their symptoms decrease by 30 or 50% or more. And, 37%, that's not bad. And it could be better, but it's not bad. And then 29.1% of people improved so much they were considered to be in remission. Something important to point out about this clinical trial, though, was it was attempting to treat the most difficult cases of depression. This was treatment-resistant depression, meaning that everybody in this clinical trial had already undergone at least 2 other attempts at treating their depression before with no avail. So perhaps if we were to do this in a population of people that just had regular depression, the results would be much higher. In fact, there were some smaller studies that were done, even using Compass Pathways psilocybin, Comp 360, that showed much better results, although there were issues with those studies. For example, it was an open label study, meaning there was no control group. So the best data that we have to go on is this treatment-resistant depression study. And like I said, it was positive. The results were much better than the placebo. I don't have the number in front of me, but I think I can put that up on the screen when we're doing the editing. It was much better than the placebo, but it was still like less than 40% of people. So take that as you will. It was a little bit depressing. It was a little bit disappointing, the results, but still very positive. Moving on, next up, the big thing that happened over the course of the year was all of the decriminalization efforts. So we saw cities just straight up decide we're going to decriminalize psychedelics. So for instance, Detroit voted to decriminalize psychedelics, the City Council of Seattle voted to decriminalize psychedelics, another Washington city whose name I'm blanking on right now just voted to decriminalize psychedelics, and then we saw the movement within states to decriminalize psychedelics throughout the entire state gain a lot of steam. So of course in 2020 we saw Oregon vote to legalize psilocybin, and we have similar bills making its way through the legislatures right now in states like California, Michigan, and Florida. I'm not 100% sure how likely these bills are. I would say California and maybe Michigan are the most likely, but we can't count any chickens before they hatch. Hopefully these will pass in 2022, but it's just too early to tell, guys, unfortunately. But that was a really big storyline of 2021, rather. I don't know where 2020 even went. I'm still thinking it's 2019, guys, but we're about to be 2022, so whatever. But anyhow, decriminalization 2021 really picked up steam. Super excited about that. Super excited to see where that goes in 2022. Alrighty, so was that 5 things? That sounded like 4. So we got our IPOs, we got our funding, we got the MAPS trial, we got the Compass trial, we got the decriminalization trial. That is it. Perfect. Awesome. We got our top 5 events of 2021, guys. But what are we looking forward to in 2022? So first of all would be phase 3 clinical trials. So we already got one. We got a MAPS phase 3 clinical trial. However, the population size of that was still relatively small. In 2022, we will be seeing larger phase 3 clinical trials. So MAPS is actually doing another clinical trial that is using MDMA to treat PTSD. Again, it's phase 3, but this time there will be hundreds of participants, I believe over 300 participants, instead of several dozen. So that will be very exciting. If this clinical trial comes back with the exact same results with a much larger population group, then we can really start breaking out the champagne, I think. If we start getting this clinical trial repeated time and time again, if we can really say with a high level of certainty that MDMA can treat PTSD, then it's game over, at least for the PTSD treatments. Of course, we still got to do everything for depression, anxiety, all the other mental health conditions, ADHD, maybe some physical health conditions, but on that one indication, it is looking very positive. So in 2022, I am extremely looking forward to seeing further data from MAPS. Of course, we also have the Compass Pathways Phase 3 clinical trial, and that will be treating again treatment-resistant depression using psilocybin. Hopefully, we'll see a few differences in the design of that trial as compared to the earlier one. So something that I know they're looking at right now is whether or not to allow patients to continue to use their SSRIs when undergoing treatment. And this is important because if you've been on SSRIs your entire life and then all of a sudden you stop cold turkey, of course you're going to have withdrawals. So perhaps some of the less than stellar results we got from Compass Pathways trial could be due to the fact that these people stopped taking SSRIs. Again, that is complete and total speculation. I have no idea, but that is one of the speculations out there in the psychedelics verse right now. So hopefully we'll see better results from their phase 3 clinical trial due to some reforms to the way they structured the clinical trial. But again, that's something I'm looking forward to in 2022. Other things I'm looking forward to in 2022 is a bunch of MindMed stuff. So we just started, or they announced that they're starting, rather, MindMed's phase 2A clinical trial attempting to treat adult LSD with small doses of LSD. Did I say adult LSD? I'm not sure if I did or not, but I meant to say adult ADHD with small doses of LSD. Hopefully that trial will wrap up next year and we will get some data and they can move into phase 2B trials. Hopefully, fingers crossed, they can get into their phase 2B clinical trial attempting to treat generalized anxiety disorder using large doses of LSD paired with talk therapy. We covered recently that this trial has been delayed. We don't know how long it's been delayed for. Hopefully, it will be up and running in early 2022, but it's too early to tell. We don't know at this point, but I'm looking forward to that in 2022 as well. Also, their 18MC to treat addiction, opioid use disorder addiction. Hopefully that will start in the early next year, also early 2022 as well, so looking forward to that. And then, of course, we're just looking forward to all the other studies as well. Like, USONA has a study going on. Wasana, I believe, is going to be launching their clinical trial attempting to treat traumatic brain injury with MDMA. There are literally dozens of clinical trials that are going to be underway next year that I just don't really have the time to get through. But as each one comes out, we will cover it on these channels because they're very exciting. And then, lastly, something I am looking forward to is mergers. So we talked about how a lot of these companies have boatloads of cash and how there are also like 40 companies right now. A lot of those 40 companies don't have boatloads of cash, and eventually they're going to run out of money, especially if their stock is low. So I would definitely expect to see 2022, one of the main storylines be a lot of these smaller companies either merging or being eaten up by either the larger companies in the field or by traditional pharma. I think as we start to see a lot of these clinical trials come back, I think traditional pharma companies may start eating up some psychedelic medicines companies, so definitely look out for that in 2022 as well. And finally, the stock price. Save the best for last. What do I expect to happen to the stock prices in 2022? Guys, I literally don't know. Sorry to be a bummer. Maybe let's just use MindMed for example. At the time of filming, it was around $1.67 American. Again, this video won't come out for like a week or two, so I don't know what it will be like when you guys see it. But by the end of 2022, who knows? Maybe it could be all the way back up to $4. Maybe it could be higher. Maybe it could be $6, or maybe it could have fallen again. Maybe we could be at $1 by the end of 2022. And I just don't know, but if you guys are in this for the long term, it shouldn't really matter. Something I've said a million times on this channel is if you have a 5 to 10 year time horizon and the stock is currently this price, I don't know if you can see me on the camera right now, but if the stock is currently this high and you think it's going to be this high in the future, then it doesn't matter that if in the interim the stock dips down to this low. So that might happen. obviously it sucks. It hurts to look at your portfolio when that happens, but we don't have a crystal ball. You guys just need to stay laser focused on what matters, and that's whether these teams are executing, whether they have the money to execute, and what the clinical trials are that they're doing. So we're going to be keeping an eye on what matters in 2022, and hopefully these stock prices will reflect that, but who knows? Alrighty guys, I think that is more or less all I wanted to say. Sorry if that was really confusing. I'm going to have to definitely watch this over again to see if this even makes any sense whatsoever. If it does, then great, we will post it. If not, then maybe you'll never see this and I can do a little dance move. I can make a fool of myself or whatever. But yeah, I hope you guys all had a happy holidays. Last chance, you want to put any questions in the comment box here, do it now, and I will just wait. I'll do a little dance while I'm waiting, blah, blah, blah. That's a good question. I mean, I don't know what the question is because it's not coming for 2 weeks, but that's a great question, guys. Anyhow, if you enjoyed this video, you know what to do. Like, subscribe, hug your mom, do all that great stuff. I love you all. I'll see you in 2022.